Do you often worry when your baby keeps getting fever after fever, even though you keep them clean and fed? Or maybe you've noticed that small cuts take forever to heal, and infections just never seem to go away. These could be signs of something deeper going on inside the body, like a shortage of germ-fighting soldiers in the blood. That's what happens in severe congenital neutropenia, also known as Kostmann Syndrome. It's a rare but serious condition where a baby is born with too few neutrophils, a type of white blood cell that fights bacteria. Without enough of these cells, even tiny infections can become life-threatening. Imagine your body as a castle. Neutrophils are the guards at the gate. In Kostmann syndrome, there are very few guards, so germs sneak in easily and cause trouble. This condition shows up in the first few months of life, so early detection is key. So why does this happen? What causes Kostmann syndrome? Think of genes as instruction, manuals the body uses to build and run itself. In this case, there's often a typo in the instruction book, mostly in a gene called HAX1. This typo means the bone marrow, the blood factory inside your bones, can't make enough neutrophils, or the neutrophils die too quickly. It's like a factory that keeps shutting down before finishing its products. Most of the time, both parents carry a silent copy of the faulty gene without showing symptoms, kind of like carrying a hidden puzzle piece. When a baby inherits the broken piece from both parents, the puzzle doesn't fit, and the condition appears. This is called autosomal recessive inheritance. So it's not something you catch, it's something a child is born with due to genetics. What should parents or caregivers watch for? Let's play detective. If your newborn or infant frequently has high fever with no clear cause, sores in the mouth or diaper area, pus in wounds, serious skin infections, or repeated lung infections like pneumonia, these might not be just bad luck. In babies with Kostmann syndrome, even a small gum irritation during teething can turn into a major infection. They may also have slow-healing bruises or recurring ear infections. Some babies have delayed tooth growth or mouth ulcers. Remember, all babies get sick, but if infections keep coming back every few weeks, it's time to ask, could this be more than just a cold? Early signs are like warning lights on a car dashboard. Don't ignore them. First, they take a blood test, a simple prick to check the number of neutrophils. If the count is very low, usually under 200 cells per microliter, alarm bells ring. Then they may do genetic testing to find mutations in genes like HAX1. It's like running a diagnostic scan on the instruction manual to find the typo. Treatment isn't a cure, but it can save lives. The main treatment is daily injections of a medicine called G-CSF, granulocyte colony stimulating factor. Think of G-CSF as a loudspeaker shouting, "Wake up, bone marrow, make more neutrophils." Most kids respond well and have fewer infections. But in severe cases where G-CSF doesn't work or the risk of leukemia is high, a bone marrow transplant, getting new blood making stem cells from a donor, might be the best hope. It's like replacing the broken factory with a new one. Can we stop Kostmann syndrome before it starts? Right now, we can't change genes before birth, but we can plan. If a family already has a child with Kostmann syndrome, there's a 25% chance the next child could have it too. So genetic counseling is super helpful. It's like talking to a family health detective who explains your risks. Couples can get tested to see if they carry the faulty gene. During pregnancy, tests like amniocentesis or chorionic villus sampling can tell if the baby has the condition. While we can't prevent the gene change, yet early diagnosis and treatment can prevent life-threatening infections. So prevention here means catching it early and acting fast, like installing smoke detectors before a fire happens. The good news, science is moving fast. Researchers are testing gene therapy, a way to fix the faulty HAX1 gene inside the patient's own cells. Imagine editing the typo in the instruction manual and sending it back to the factory. Early trials show promise. Kids treated this way might not need daily injections or transplants. Other studies are improving how GCSF works, or finding new drugs that protect neutrophil-making cells. Scientists are also learning why some patients develop leukemia years later, so they can stop it before it starts. These advances aren't widely available yet, but they're glowing lights on the horizon. For families affected, this means hope, and maybe one day, a world where Kostmann syndrome can be fixed at its root.